Hi everybody, I'm Dr. Qazi. I'm over in Newport Beach, California, and I specialize in acne and scars and pigmentation. And I want to talk about a big subject that I get questions about every single day, and that's with subcision. So for those who just joined me, I really want to actually focus a lot on the procedure of scars, the pathology of scars, and really talk a little bit about why something like subcision could be really useful for the right kind of scars, and also recognizing that there are risks involved with subcision and how we could do it more safely. So we'll wait for a few more people to join us tonight, and then we'll kind of get into it. But some of the slides that we're showcasing right now are with subcision and just the overall process for breaking up scars, particularly in these cases, rolling scars. So you can see, I'll actually kind of improve the photo a little bit here so you can see a little bit better. But what we're working on really is the process of subcision and what kind of subcision and which layers of the skin we're going to be doing it on for when we're fixing scars. So we could showcase a few things over here. This is a particular patient that I did subcision with, but then he ended up really having a lot of volume loss afterwards. And so we had to do a fat transfer. So you can see that improvement as well. I'm actually going to make it a little bit clearer for you so you can see these photos. It's a little bit too fast right now. And I'll try to help you out so you can kind of see all along here as we do this. But part of what we see every single day, everyone always asks me about subcision. They always constantly say that they're worried about it. We shouldn't say everybody. People that kind of watch these already know, but a lot of people who are kind of just like in sort of chat forums or whatever, on the internet. And it's understandable. Like I do think that there's a risk to it. And I think there's just a way to do it safely. It's just that we just have to educate people about what makes it different when we're doing it. So I'm going to kind of showcase that with you and in terms of the layers that we're working on, in terms of how I'm doing it with certain tools, and especially also the location of the scars. So if you look for this, for example, for this particular patient right over here, we're along the bony process, the zygomatic arch. And for this particular patient, we blew up the area with a lot of tumescent fluid, lidocaine with epinephrine, and then we went inside there and actually broke up the scar tissue really effectively. You could see the layer that we were in was really actually what we call intradermal. So I'm going to show you a slide of that as well. And what I mean to say is that we're not going down to the fatty process at all. And essentially, we're making sure as we do it, we're using the right tools. Let's see. NM is saying, "Hi, Dr. Qazi, I messaged you. May I ask, does this procedure hurt?" No, actually, it really doesn't hurt. I've gotten it done myself too. It does not hurt. It's something that I think is, looks frightening. I can see why it looks scary. A lot of people say that it looks scary when they watch the video. But really, you're really numb inside there. The things you're going to feel are just the pressure a bit of like the fluid, which I warn you about as we do it, as we go in there. And it just causes a little bit of anxiety as we do that. So you can have some anti-anxiety medication if you want, if you are somebody who's anxious. But the vast majority of people, even if when they do say that they have some anxiety, they've been okay with that actually. They really don't complain about particularly too much anxiety even during the procedure, or certainly no pain really at all. There's so much numbing medication that we could put inside there to make sure that it's as comfortable as possible for patients. So pain is not really something that we're particularly concerned with because of just how much solution we could put in there. Let's see here. A is asking, does it sag the skin? So really good question. I think it's possible. I do think it's possible in certain locations to cause sagging. If you look at this photo right over here, this is showcasing subcision. And if you look, actually, you'll see that there's a possibility of going really deep. If you go really deep into the fatty layers over there, now you could displace some fat. That's one possibility. And now the other possibility is in certain parts, basically, for example, like the lower part of the face, some of the fat pads are held by really superficial ligaments. And so if you really use blades in certain areas like that, you could potentially displace some of those ligaments, and you theoretically could cause fat herniation. It's possible. I think that some people would say that there's not enough evidence for it, but I think it's possible. And there's a really anecdotal, people do say that it's occurred. And I think a lot of times studies sometimes could lag with things like this, so we just sort of have to pay attention to it. I think it makes sense. To me, it makes sense. It's like, I don't know why I would use certain blades in certain areas, especially someone's asking about the tear liberator. I really don't use that in the lower part of the face like that. I do blunt cannula subcision there. If I need to use a needle, then it's a small little needle for like small little spots right there, really localized things, but it's really, really selective for blades. And even when I'm using the tear liberator, I do it very differently than the way a lot of people do it. I do it really where I am localized, even in areas where I think it's relatively safe. In the zygomatic arch, for example, I'm using mostly blunt cannula. And then what I end up doing is if it's really stuck, either I use a tear liberator if it's really intradermal, or I may actually end up using something like a Noker needle. So it sort of just depends on what layer it's at or how thick it is. One of my patients today, he had 7 subcisions with laser done, and there was still a lot of tethering. And it's really unfortunate, really, really unfortunate that somebody put him through. I don't know if you're on here right now today. I felt bad for you. It's just that like he went through 7 subcisions and they didn't do it properly. It's really sad. One of the other patients that we showed a video on a little while ago, we'll show his subcision portion. He's not allowed to post on certain social media platforms, but we'll show it where we can. And he had done 6 subcision sessions, some with like acne scar specialists, and there was so much scar tissue in there. And so it's like, how you do it, really. It's there's just no question about it that there's a way to do it, and it's true that with certain people it may not be effective because of how they did it, really. That's just the truth. It's sort of, like if you go and get sushi at like the grocery store and it's like not super fresh, and it's like suddenly like you like end up going to a really good place and you're like realize that there's like a whole different level of sushi. And it's like, actually, it turns out like I never really was eating sushi because I always thought it was kind of gross. And then I went to Nobu and it was like amazing. And I was like, wow, maybe there's like there's a whole nother thing here. And I was like kind of writing off sushi for this whole time. And it turns out like it's like you could do things actually really, really well. And they're like sitting there and like you could see like they're chefs and they're cooking. They're not cooking, but they're chopping it a really, really perfect way. And it's like, okay, these guys really know what they're doing, and like it tastes really good. But if you go to like a random grocery store and you try to get that sushi, it's not gonna be great. So it's like sort of the same type of thing with these procedures, really. It's like you go to kind of like these random people and they're telling you to do 6, 7 subcisions off. And it's like, you guys really look at that as like a red flag. It really is. It's like, why are you doing like a package of subcision? Like, why aren't you doing it right the first time? It's an invasive procedure. So like people are concerned about like sagging and things like that. Well, yeah, if you're going 7 times, there is a concern with that because you could mess up now. You could potentially, like you're going so many times inside someone's skin, and now you could go into the wrong layer potentially. 7 times. It's unbelievable to me. So I've never had to, I have less than 5 people have I had to do subcision more than once, so it's like, I'm happy to do it if we need to do it. Certain areas, like it's very deep and I want to make sure it's really safe for patients. Sometimes I do have to stage it, but really rarely. So it's like, I don't know, what some of these people are doing, that they're charging people 7 times subcision, when clearly you probably should just double check how you're doing it, but probably just don't do this. This isn't for everybody. So it's like, I don't know, sometimes it's like, it's kind of wild to me what's out there. And another patient that I was working on today, he did, of course, he had very, very thick scars. Actually, I showed you his results before, but we're going to have updated photos now because his skin looks amazing. And he had done 3 microneedling sessions. His scars were so severe, so significant. He did 3 microneedling sessions before. It's really unfortunate. It's like his really super thick scars and they're doing microneedling. It says, Cheers to Geisha saying, Dr. Qazi's better than Nobu. I liked it though. It was really, really good. Let's see here. Carrie's saying, I got a few chemical peels and they didn't help my scars. Should I try microneedling? It depends on what kind of scars you have, honestly. If it's really superficial, maybe it'll help, but I probably wouldn't even help you out. I probably wouldn't recommend, to be honest with you, the microneedling for scars. Joey's saying 7-Eleven sushi in the States versus sushi at Nobu, not even a comparison. Exactly, that's the thing. Miri is saying they are doing the subcision too superficially. I'm not even sure if they're doing too superficially. I just don't know what they're doing, honestly. I'm not even sure what they're doing. You go in there and there's so much scar tissue in there, and it's like, what were they really doing with that? I'm not sure. Why was it so problematic for them? Let's see here. Do you ever use pickle forks with subcision? I had that done in the tough spots. I don't love that. I did do it early on. I will say though, I think it was really, it's really a lot more risky than even than the Tailor Liberator. I'm not really a fan of it. I think it's really high risk. And for people that were concerned really about like fat displacement, things like that, I think you really could get more fat displacement with that. So I kind of, ditched it pretty early on because I was like, when I was looking at it, it was very aggressive. I was okay for like a tight spot, but it was like, once you like pull out and come back into it again, I just felt there was a lot more trauma than I would love. And so it just was a little bit too wide for me, and really sharp. So I didn't love using it. Basically, what the question is, basically there's a type of, basically it's like a pitchfork basically, where you could go in there and you could cut the bands really. So theoretically it seems like a good idea, but it's riskier really. And I just, I like coming on here and just, explaining how I'm very safe. And so I was just like, I just don't want to do that. And it was unnecessary because we're still able to get excellent results without something dangerous and risky like that. So I was worried about that. Smiles is saying, would you say zygomatic arch is a safe area to do subcision? I would say so, yeah. I mean, of course, it's still potentially risky if you're going too deep and you're going to the fatty tissue and you're displacing some of the fat, and that's possible that somebody's doing that. I think you just have to be exceptionally careful with who you're going to. Let's see, Claire is saying, what Sculptra? It is thumbs up. Good question about that. I wouldn't really necessarily say it's thumbs up at the same time per se, because you may be going into the wrong layer that you may not expect it to be. And Sculptra could be really dilute and it could end up spreading in areas that you may not want it to. So I understand sometimes we could do it sometimes, but I wouldn't really say that it is like just the best thing ever, to be honest with you, because I would usually like to stage it. Like this patient right here, we staged it. We first did Tailor Liberator subcision, and then we saw him again, and then we did fat transfer for him. So it ended up working perfectly well for him because I wanted to be super precise when we did this, and we were. So it's like first you did we did Tailor Liberator subcision, and then we waited about 6 weeks or so afterwards. I can't remember exactly, but roughly around that time, waited for his swelling to go down, and then we did fat transfer, and it worked out really well. Taylor Blue is saying, wow, that's a lot. Do you usually need one if it's done correctly? That's correct, yeah. This is the point. Like, I want it to be done properly and effectively, and I look at this like this is my one time. I don't want to put somebody through this. It's a lot, traumatic to do this. There's a lot of anxiety that's involved with it, a lot of things, and I would never want to do that so many times. I want to make sure it's done really well. Carla is saying, the liquid injected during the procedure is absorbed. How often should this procedure be done? Well, that's my point, that you don't have to do it too much. You really shouldn't have to do too much. Let's see here. Lovey Dovey saying, how do you choose between fat and filler after subcision? Well, it depends on how much volume loss there is. One of the gentlemen that I just showed over here, he had so much volume loss, he opted really for fat transfer because he knew that it was just going to take a lot of filler to be able to improve those scars. So fat ended up working really well for him. And, he's got to keep his results. It's really nice for him. Kane is saying, I think we answered this about the chemical peels. Let's see here where we are. Let's see, how much is it worth? Our prices are on our page. Most patients spend between $5,000 to $7,000 for their scars. What is the best scar treatment for an appendix scar? Usually it's going to be more like an erbium laser, probably, what I would probably end up using. Let's take a look. Sometimes, it could just be like red and angry, and so we may just want like a vascular laser. It just sort of depends on what we're seeing over there. Let's see here. Mary's saying it needs to be subdermal and pickle forth or Noker for tough areas. Not really subdermal, intradermal. Not really necessarily subdermal. That's not actually correct. I typically don't do it fully like subdermal like that. And I really wouldn't do pickle fork, as I was talking about earlier, that I would recommend, especially if you're doing subdermal. I think it's really easy now to go into the hypodermis and then basically just end up just, you could end up just essentially just displacing some fat there. So wouldn't really recommend that. In general, I try to keep it really safe. And even though it's safe, we're still able to get really excellent results. So there's a fine balance with this, like it really is. And there's like this line that we want to just stay at where we want to get excellent results, but we also want to stay really safe. And between those two things, between the result versus safety, I'm always going to choose the safety portion of things. And just this is how I am. And so it's like, it's always like something that I'm going to hold myself back if I feel like it's going to be a little bit dangerous for us. And then we may stage it. You'll be one of those patients that I say, if it is really stuck down there, that potentially we want to actually have you come back later on for another round, potentially. But usually it's more like a volume loss issue. So we just need to just give you some volume there. How bad does subcision hurt? It doesn't hurt. That's the thing. It doesn't actually hurt. It's a lot. There's a lot of tumescent. Basically, that's a numbing solution in there. A lot of that in there, and it's just completely numb. So it does not hurt. Lily's is saying, hello, doctor. Blessings. How much does subcision cost per session, please? Well, usually it's just one session. It's about $800 typically to maybe $1,200 or so. Let's see here. What about acne scars on the chest? It depends what we're looking at. If it's really, really deep, thick scars, sometimes you do want to do a little bit of filler in there. Like Belafil could work really well. You could do some Subcision, Belafil. That could be a really good option. I've had really good results with that. Damar is saying, can I get CO2 laser on Hispanic skin? Most of our patients are Hispanic actually. Actually, the vast majority of our patients across the board are Hispanic. So this is a Hispanic male right here. You can see some of them are what we call Fitzpatrick 4. This particular patient is Fitzpatrick 5. So we do all skin types as well, but the vast majority of our patients are actually Hispanic. Let's see here. Fran is saying, can I do microneedling by myself after Accutane? Thank you. You could. Probably the best thing to do if you're doing things at home is more like the stamping devices more than like the rolling things. That's probably going to be better. Let's see here. Tita's saying, where's your practice? Could you share your website? Someone could put my website in the comments. That'll be really helpful. But you could go to my profile and you can just go there directly on there, and you could book consultations. We do virtual consultations all the time. A lot of the patients that you just saw in here, we did virtual consultations as well. And we're able to assess these scars really well. My patient today, I did a virtual consultation with her. She was from Fort Myers. She came in here today, and exactly what we suspected. We went through this really well with her during the consultation process, and as soon as she comes in and just verify everything's correct, that the skin looks exactly like I suspected and expected it to be, and that's what it is. And it's like really very, very straightforward the way we could do this now, because as long as you show me some good photos, I'm going to go through it with the video conference call. Sometimes I'll have you just kind of pick up your phone or get closer to your camera, and we can just double check to make sure that the scars are tethered. We could double check to see what kind of scars you have. We could go through the whole process there with the virtual consultation. Young Silent saying, what about acne scars on the chest? How are acne scars on the chest treated? So I kind of just talked about that, but basically we could do subcision on the chest. It's possible to do that. I've done that many times before. You could also do a little bit of Belafil. You could do even Sculptra. You could do Radius. Belafil is probably my favorite though for that area. I is saying, how much is only a minimal scar, like one box scar? Tough to say. I'm not sure what's really needed for that. If it's excision, things like that, a few $100s probably. I'm not sure. A lot of things are just depending on my time and just how long it's going to take. Even though it seems like just one scar, but just to get the thing set up, do all the things that we have to do for it, there's still an added factor with that though. So I'm not sure exactly what that price would be. I just have to see how deep it is, how thick it is, and what's needed for that. Let's see here. Will CO2 laser help HS scars? Yes, it could. It could do that. You could also consider doing something like Belafil there. So that's another option there. How much is the CO2 versus erbium, and which is better for acne scars? So usually I do CO2 in the thicker areas of the scar, and then I use the erbium laser to blend it in elsewhere, really where the healthier tissue is. So just everything looks a lot more even out. Let's see here. Tony Santana is saying, hey doc, is it true that TCA cross can widen scars? It could for a short period of time sometimes, and sometimes if it just was done somehow like this, where it splashed outside a little bit, it could potentially do that. But it is extremely rare, and with us, it just I'm very, very careful and meticulous, so it's like it just doesn't happen. I'm very, very precise as I do. I change the concentration depending on the depth of the scars, and it's just a slow process. It is probably a little bit slower too, but you got to be really, really careful when you're doing TCA, and I'm very, very precise and very careful. Quero is saying, what happens if you don't use filler after subcision? Well, if it's relatively superficial, if it's basically more like just a tiny little bit of like a rolling scar that's pulled down, and there's not much fat loss, if the patient's relatively young, otherwise subcision by itself could just be all you need. But if there's volume loss and fat loss, you are still going to see an indentation of that scar, so you have to do something for volume then. So you have to do something. Stay True is saying, do people need to do lasers for multiple sessions, or in one session usually okay? Usually lasers you do have to do a few times for certain kinds of scars, but if it's more like ice pick scars, I probably just do it one time and just to smooth it down a little bit. Usually I don't have to do multiple times, 1 or 2 times possibly. Stay True is saying, is 6 sessions of a cure too much? Have you seen people do it this many times? I have not seen that many times. I haven't needed it that many times, so I'm not sure if that is too much. It just depends on maybe what your skin condition is. Usually for people that complain that they still have some acne, what I found was that you just have to really control their bacteria. Once the bacteria on the surface of the skin is under control, really the oil production is under control, they don't really have the acne anymore. Sunrise is saying, do these lasers cause fat loss? I think theoretically, if you really just burn down and just really just continue to stay in one area, it could potentially do that, but it's really, really risky to do that anyways, where you're using such a high energy of laser in a particular area and causing fat loss like that. Really, really risky. So unlikely, but it's also, I guess, depends on just some people out there that, do max settings and believe in doing max settings and things like that. So I guess it's possible. And they're probably also really burning holes in people though. Tony Santana is saying, another question for fat transfer. Does the patient have to go under? No, we just do it in the office. There's no problem with that. I is saying, does subcision leave a scar when the cannula enters? Good question. It's a very, very tiny opening. It's also done in a certain plane. So really, I have not seen any patient scar after subcision. Damar is saying, can I get treatments while having filler for acne scars? Possibly. It depends on what we're looking at with it. If it's really kind of bumpy from the filler, then I probably wouldn't want to do that. But otherwise, if it's, just sitting around there, we probably would be okay with that. Is there volume loss in ice pick scars? Do you also add filler volume under those? Yeah, a lot of times there's a lot of volume loss after ice pick scars. These are very, very tiny scars, but they could go very deep all the way down to the fatty layer. And then what ends up happening is that little tiny pocket of fat is broken up, and you have a few of those scars really next to each other. Now you really can get a really significant indentation. So yes, you certainly should be able to do volume replacement when there's a lot of ice pick scars. Now, if it's just one ice pick scar, that little bit of fat loss may not be enough to justify it, but a bunch in one area, likely you're looking at something to do for volume, whether that's Bellathol or Sculptra or Radius or fat transfer. All those options, consider it really. Let's see here. I know I missed a few things here. What helps PIE? Good question. I mean, I use XLV. It works very, very well for PIE. So basically, those are those little red marks. A lot of times after acne, patients will have little broken capillaries. I see it more commonly with East Asian patients. I'm not sure what ethnicity you are. I see it a lot more commonly with East Asian patients where it lingers a little bit longer. And there'll be just basically a little broken capillary over there on the surface of the skin. And it almost looks like a scar, or it looks almost like acne for some patients. But we can target that with XLV, works well. You could also try V-beam. And a lot of times azelaic acid could help as well. You want to do something to really help with that inflammation. So the last step is probably going to be a laser like XLV. Stay True is saying, is Bellathol something that has to be injected every few years, or is it a one-time thing? Well, the thing with Bellathol is that it's a very soft filler. As a filler, it's really more of a collagen producer. And the thing is that you never want to put too much into it. So whenever you're placing it in the skin, you want to make sure that you're not overdoing it. You're not overshooting it. It is something that's going to last a long time. Really, it is more permanent. Essentially, the PMMA just stays there. They did a study that showed it for 5 years, but really they just stopped it. We likely suspect that it's a lot longer than that, and probably just always stays there and continues to help make collagen over there. So there's always something there which is useful, but the problem is that like I said, you never want to overshoot it. So you likely are still going to need to do a little bit more volume. And then as you get older and you lose more fat pad, you likely are going to need to do something else for that too. So you still probably need to do something with it. Stay True is saying, if I do fat transfer and lose weight afterwards, will the fat that is transferred decrease, revealing the original scars? Yes. You should be at your typical weight and your ideal weight when you do fat transfer. If you're losing weight afterwards, you likely are now going to actually lose the fat that we transferred, and just like your regular normal fat. So you definitely want to stay at your normal healthy weight. Let's see here. I know I missed a few things here. Tita is saying, am I able to see scar improvement with just laser treatment without fillers? It depends on the depth of your scars. It's possible. I'm not sure how deep it is. Let's see here. Baba Ganesh is saying, what are your thoughts on PRF Easy Gel, and what about in the lips for volume? So I know it's been trending a lot. I used to use PRF Easy Gel. I never found it to be superior to PRP. That's the truth. That's my unbiased, unsponsored answer there. I know that I know what the reps say. I know what everybody says. I know what they kind of have people push and talk about and try to make it seem as if it is superior. There's really no evidence to say that PRF is superior to PRP. I think that initially there's a little bit of volume because of the gel, but it's not actually real volume, and it's just like PRP at the end of the day. So the end result is the same, but the cost is a little bit more. So I end up doing things where I want where the cost is a least amount for patients, but the end result is the same or better. So that's why I use PRP. That's really all it comes down to. I know that, like I said, we get calls all the time now for PRF. It really has come back and everything like that, which is great. I used it like 6 years ago, and I was using a lot of it. And I've talked about it before, that when I was really opening up my own independent practice, I had so many reps coming to me, and I was really naive about a lot of that stuff, and I was just kind of just open to just opening my doors and this guy is selling this product, but I'm sure he's a nice guy. He's like he's someone educated in this field, and I'm sure he's telling the truth about this stuff. And it turns out that there's not really much evidence for this stuff. There really isn't. And it turns out that there's not really much difference between a lot of these things that they claim is superior. Prove it. If you're going to say it's superior, you got to prove it. You got to actually showcase to me that's superior in the long run. Don't just show that it's okay, for a short period of time you get a little bit of that filler effect. What about the long term? Is it head-to-head superior to something that's more inexpensive, something like PRP? And nothing really shows that. And I don't really use it for scars unless patients want to do it for the healing process. It does help with the healing process, but it's not something that I do for scars though. I don't think that it's superior. That's why I don't want to add a random cost to patients that I don't stand by and think that it's going to be effective for patients. So that's my thing about Easy Gel. Let's see here. Is CO2 laser good for ice pick scars? If it's thick around the edges, yes. It could also stimulate collagen production. So it could help. So I wouldn't say it's useless, but there's probably better options. Definitely TCA cross is the one of the best options for deep ice pick scars. Also excisions are one of the best options for ice pick scars. But whether CO2 laser is the ultimate solution or not, it remains to be seen. I'm not sure. I think it'll help somewhat with the collagen production if there's rough edges around the scar. This patient has some ice pick scars over here you can see. And but we did CO2 laser, TCA cross with her, also a lot of volume replacement, subcision, and she got significant improvement over there. So it sort of depends on what we're seeing, how much volume loss there is to you, if we have to do some filler or collagen products. But we kind of have to see if it's really thick. This particular patient, for example, look at the thickness of his scars. That's where a laser will be really useful. ice pick scars, a lot of people don't tend to have it that way. So usually I use TCA cross with an erbium laser, especially with my patients who are Fitzpatrick 4 and above. A lot of patients, I see ice pick scars very, very commonly, especially with East Asian patients. And the way you do, you have to work with their skin, because a lot of times if you're using more aggressive treatments like CO2 lasers, it has to be really justified. It has to be something that the scars really are going to respond and really require the stronger heat that you're going to provide to it. And you're really going to have to really like justify in your mind that this makes sense to yourself. Otherwise, I use more of like a lighter laser, like an erbium laser combined with TCA cross. That's usually what I end up doing, especially for patients who are like East Asian, where I see a lot of ice pick scars. But my other patient that actually I mentioned last week, that I had a patient who was in her 50s and she had significant improvement of her ice pick scars already. Now I just saw another patient yesterday, also East Asian descent, and it's like significant improvement from her ice pick scars. Ultimately, it does work. I have like been asking patients. Most people, now I'm going through it still, a lot of people are saying that they are eating pretty clean. They're avoiding certain triggers, things like that. I've also been talking to you guys about like water too. I'm going to start going through, we're going to actually start testing people's water like at home and stuff like that, I think, and just kind of seeing what the acidity is and like seeing what kind of minerals there are, because it's like, I really do think that plays a factor in the prolonging the inflammation for some people. And what ends up happening is that you're still a lot more red, it's inflamed, and now you're not developing as much collagen potentially. That's possible for some patients. Had a fit is saying, what about C-section scars? Probably more like a erbium laser if it's just a proper C-section scar. But if it is truly like just like some of the skin laxity, then you may have to do potentially like a tummy tuck. It sort of depends on what's happening. What do I think about Sculptra? I love Sculptra. It just depends on where you're placing it and how you're doing it. It can be really dilute, so you just you do it more reserved for like significant volume loss. Ava is saying, how can you Aya is saying, how can you determine if acne is leaving a box scar with redness, but when you look closely, it is plain? And I'm a little bit confused by that, so you may have to rephrase your question there. Let's see here. What are the most common triggers for your patients? Well, probably Jerry is most common thing. Sugar intake is also a really common thing. So those are probably the most common issues that people have with triggering, especially for like oil production. So dairy is probably the number one though. Stay True is saying, will a cure laser help with acne scars? I noticed that after a few cure laser sessions, my acne scars have gotten softer. It's a good question, actually. I just had a patient who did 3 sessions. I saw her right now. Her scars actually are really, really good. We did her scars today. And from where it started to where it is right now, she's like 6 months after her last session. Really, it is a lot softer. It was so much easier to do her treatment. It was like already really superficial. So there is a bit of a collagen response that occurs as you reduce and normalize oil production. So normalizing your oil does stimulate more collagen. So that's why it's possible that the cure is helping with some patients' acne. I'm going to have a little bit last question here. Z is saying, I would love to hear more about the water test. I have a feeling our water is a culprit in inflammation. Yeah, I mean, that's what I'm looking at right now. I'm taking a look and seeing, we will see at some point, probably after the holidays, though, to be honest with you, because it's really, really busy right now. But I'm going to try to have my team like just kind of go home and like test their water and like see what's going on over here. And maybe some patients that are out of state will see where what's going on with their water. I've really been seeing some people like heal so well from out of state. And some patients that are in certain states, it's like prolonged, and they tell me, I'm like, what about your water? And like, oh yeah, my water is terrible over here. Like everybody knows their water is here, but they're doing that with their showers and they're using that for washing their face every day or washing off like, their products and stuff like that. And it's possible that's causing inflammation in their skin. It's like, I don't know. And maybe the fluoride, who knows? I don't know anything about the fluoride situation. Does anyone really know? Like maybe there's like excess amount of fluoride in some areas and things. Does anyone ever double check this stuff? The whole thing with like that fluoride thing is like, when you dig into it, it's like a really